Good afternoon. I'll be presenting Furcation involvement. Introduction. Furcation is an area of complex anatomic morphology that once involved is difficult to debride by routine periodontal instrumentation. Coming towards the definition, furcation, anatomic area of a multi-rooted tooth where the roots diverge. Furcation invasion, pathologic resorption of bone within the furcation involvement, invasion of the bifurcations or trifurcation of multi-rooted tooth by periodontal disease. Now coming towards some etiological factors, including those of the anatomical consideration that causes the furcation involvement, that includes the root complex, in which root trunk, the root cone, the root trunk should be smaller enough. The smaller is the root trunk, the better will be the prognosis for the furcation involvement. Then is the furcation entrance, furcation fornix. Coming towards the etiopathogenesis, this includes plaque associated inflammation, trauma from occlusion, contributing anatomical factors like cervical enamel projections, root trunk length, root form, interradicular dimensions, anatomy of the furcation. Now coming towards the classification, we have various classifications for the furcation involvement. Some of those we'll be discussing over here. So first is the most important one, depending upon amount of tissue destruction, which is given by Glickman in the year 1953. So in this, first is the grade 1, where incipient or early lesions with suprabony pocket, there may or may not be, and mostly there is the absence of the radiographic changes. Coming towards the grade 2, lesion is cul-de-sac with definite horizontal component. Here the radiographic changes may or may not be present. Coming towards the grade 3, bone is not attached to the dome of the furcation in grade 3. In the early grade 3 involvement, the opening may be filled with the soft tissues and may not be visible. Okay, now coming towards the grade 4, through and through involvement of the lesion with soft tissue has receded apically. Now coming towards the next classification, which is depending upon the horizontal extension of the lesion, which is given by Ham in 1975. Here, degree 1 is the horizontal attachment loss, which is less than 3 mm. Degree 2, horizontal attachment loss, which is more than 3 mm. And degree 3, the horizontal attachment loss, which is through and through destruction, is there. The photographs of all the 3 degree of furcation involvement has been provided. Now, next is the depending on vertical extension, which is given by Turner and Fletcher in the year 1984. Here, the vertical extension group A, where 0 to 3 mm of involvement is there. Group B, the subgroup B, 4 to 6 mm of involvement is there, and subgroup C, more than 7 mm of the involvement. Now coming towards the diagnosis. Here the furcation involvement can be diagnosed by 3 ways. First is the clinical examination, then transgingival probing, third is the radiographic examination. And for checking for the furcation involvement, the probe which we use is the Neighbors probe. Now coming towards the treatment of grade 1 furcation involvement. So the first and foremost treatment is we go with the non-surgical periodontal therapy, which includes oral hygiene instructions, scaling, and root planing. Then, if required, surgical intervention is to be carried out, which includes the odontoplasty and furcanoplasty. Then, for grade 2 furcation involvement, these are the treatment modalities: furcation plasty, tunnel preparation, root resection, tooth extraction, and guided tissue regeneration, and the Amdogen or PRF treatment. So now some other treatments for the grade 2 and the grade 3 furcation involvement. This includes root amputation, bicuspidization, and hemisection. Root amputation is characterized as the removal of a root without removal of the overhanging portion of the crown. Bicuspidization, this is a procedure done for mandibular molars where a single molar tooth can be converted into two bicuspids by retaining both the mesial and the distal root. And hemisection is defined as the removal of half of a tooth performed by sectioning the tooth and removing one root. It is frequently used with reference to the lower molars. Coming towards the conclusion, for the grade 4, we go for the extraction procedure. Now conclusion, furcation involvement presents both diagnostic and therapeutic dilemmas. The key to long-term success appear to be through diagnosis, selection of patient with good oral hygiene, and careful surgical and restorative management. These are the references. Thank you.